Aline, I'm going to show you how to do a SOAP note for the ChiroTouch. When you get into the system, this is the main screen. You're going to see the spine, the listings, and the techniques that I've used to treat the patient in like Easy Force. Okay, over here is just insurance information which you don't really need to know about or deal with. However, what it is important is the alert that's here on the bottom right here. So look for these because they tell you what's going on with the patient and if there's any contraindications I have for treating. Okay? So here you do. You come up to where it says chart note up here. It's in orange. You click it. Now, everything is going to go based on the subjective, the objective, the assessment, the plan, as you know. This is only going to be involved for you for the most part if we're doing an examination. This is your day note. So if there's anything here that you want to add to the note, that's fine. All the blue is the drop-down boxes. If you see a red, that's going to lead you to a whole new set of categories and then the drop-down box. For example, aggravating factors, you now have all these. I personally only deal with the ones that say can because I made it simplistic, so you can just choose whatever you want to choose here. These are the blue drop-down boxes, okay? So let's go back to the day note. We are in subjective. Since my notes are all done already, all you need to do is go into the blue and see if it pertains accurately for this patient on this particular visit. I like to put same noted on such and such a date because it tells me that I've reviewed it on this date to that date. So I don't want conflicting dates. It tells me that I reviewed the subjective portion of this note. So I'm done with 1 out of 4. 1, 2, 3, 4. So I come down, if everything's the same, you may have to change a pain setting. You may have to see whether it's local or radiating. If it's radiating, you just hit this, and then you just type in where it's radiating to. I don't have a drop-down box because there's so many variations. Okay, so that's it. So we do that for the chief complaint, second complaint, and any other third complaint. I usually like to have a pain description. You can choose to put the pain description after each complaint if you want to. So if I wanted to do that, I would just come into here. I would hit next, come up. I would go into, I'm already in the daily note. So then I would come over to pain description. Because it's in blue, that's my drop-down box. So I would say, it's achy. I hit next. And it's already got the heading, and she describes the pain as achy, which would pertain to the chief complaint. It's up to you. I don't mind. The more specific you are, great, but you have to have the time to do it. So let's go to objectives. The only thing in the objectives you're going to change is leg checks and palpation. I typically will do the palpation dead last, unless there's only one complaint of like a lower back. Because as I'm standing on the flexion distraction table, I can feel their lower backs, and I can feel this in immediately. I can't feel their neck or their upper back while I'm on the flexion distraction, so I typically leave this section for when I'm completely done with them and I come back to it. And that would also apply to the hypertonic muscles or muscle spasms as well. So I don't manipulate this until the end. The assessment, you're never to change the subluxations. If you needed to add something, go ahead, but we're not going to change the diagnoses as well unless there's a new exam. Okay? So you could change something along here, factors that are affecting their, you could look at their progress, and you would say, well, they're progressing well, or let's say they're exacerbated. All of these are going to give you different categories of what you think is appropriate for them at that point in time. So you just choose whatever is appropriate. So there's really only 1 or 2 things I ever touch on the assessment portion. The plan is, this is my care plan. All right, unless that needs to change, unless we're in there, this is the date the care plan was written. So we don't change that until there's a re-exam, and that's when I change the care plan. This is what we did today. So if we don't do this today and the patient's feeling great and we didn't do therapies, just highlight it and cut it out, and we didn't do it. All right, if we did it, then just leave it. And just make sure it is to the right region, that we did it to the lumbar spine and not the cervical spine, okay? Then we come to the manipulations. Well, that's easy. This is just a flexion distraction on my IT table, on my flexion distraction table. If you don't do it, cut it out. Just cut it out. No big deal, okay? Now, this is what I've adjusted. I've break the categories into a couple. This is the technique category, so it tells you what I've used. So I've either done side posture, I can do drop. I don't put the flexion distraction because I have a different icon for that. So whatever your technique is, did you do Gonstead with the patient in the supine position, or did you do Gonstead in the prone position, like a double thenar, or a prone position? Okay, so whatever it is that you do, since I do all these in the face-up position, these were the segments that I did. And you can get specific between right or left, totally up to you. I didn't get that specific on some of them. On occiput, I did want to know. Okay, so now the next one was I did a side posture. Well, what did I do it to? I did it to here. The only thing is, if you hit this, it says pelvis. You gotta 86 pelvis and actually physically type in SI joint. Okay, and I will get over to the shortcuts with you in a few minutes. Okay, so then these are my short-term goals. These are when the goals were written. Okay, so I want to keep these. So it's for about a month. 3 to 4 weeks, should end around 3/26. Well, we're not there yet, so that's why these goals are still in effect. Okay, and this is the return date. Okay, and you'll see we come in here. It's either days of the week, 1 week, 2 weeks, 3 weeks, a month, or I could be generic and say 1 week, twice next week, or so forth. Okay, all right. Next. So again, just do what you feel you need to change. Don't go crazy on each note. You don't have to do it. I'm going to show you some of the shortcuts that I've done on the iPad so that you can make these notations easier and faster. Okay? And then you can go from there. All right, this is going to be on the second video.